Good morning, everybody. It's Facial Plastics Friday. Dr. Brace here, and today I am sitting in a hotel room just outside Washington, D.C. in Arlington, Virginia, looking out my window at the Pentagon, and I'm here because I am proctoring the American Board of Facial Plastic and Reconstructive Surgery exam. So today I just wanted to talk about training. What goes into the training of becoming a board-certified facial plastic surgeon? In Canada, we don't really have a board. We have the Royal College of Physicians and Surgeons, and they essentially are our board, but the term board certified is really an American term. I am a certified fellow of the Royal College of Surgeons of Canada in my head and neck surgery training, which I did at Dalhousie, but I'm also board certified in the United States because I did a fellowship in facial plastic surgery here and wrote and passed the board exam. And so let me just walk you through what that means. After 4 years of medical school, a facial plastic surgeon usually would do a 5-year residency in head and neck surgery, otolaryngology head and neck surgery. And that's the specialty of taking care of everything above the collarbones, except for the eyeballs themselves, the spinal cord, and the brain, although we often do help out in those surgeries. Part of that training is facial plastic and reconstructive surgery. In my case, it was 6 months of my 5-year residency. And after my 5-year residency, I knew that I wanted to subspecialize in facial plastic and reconstructive surgery. And then I went to Ohio and completed a 1-year fellowship focused solely on reconstruction of traumatic and cancer defects, as well as cosmetic facial surgery. And so the candidates that are writing this exam have had a similar course. They've done their med school, they've done their training. There's actually some general plastic surgery trainees that do write this exam and become facial plastic surgeons. But they are all here at the end. This is the culmination of their training. They're at the end of their fellowships, or at the end of their road in terms of training to become a facial plastic surgeon. And the last hurdle is to get board certified. So it means that they're being vetted by their peers. And so this exam is a 2-day exam. The first day is a written exam. It's 6 hours of basically knowledge testing. And the second day is an oral exam where you sit with a seasoned facial plastic surgeon who has some scenarios that they will then ask you questions on. Examples like, here's an example of a dog bite to the face. Take me through how you would care for this patient. And you really test not just the person's ability to recognize the right answer on a multiple choice exam, but their ability to think independently. So my job this weekend as a proctor is to ensure the integrity of the exam, make sure no one's cheating, make sure it's administered properly and collected properly and graded properly. So that will be what I'll be doing all weekend. We're actually examining the 2020 and 2021 fellows because the exam was canceled due to COVID last year, so it's going to be a busy weekend. But if this interests you at all, I'll be adding some pictures to our stories of what the exam process looks like. So stay tuned. Everybody have a great weekend and enjoy the fall weather. Bye-bye.